So what do we do about the IT band? What are we doing in therapy? What are we doing in training? First thing we have to be thinking about is you can't stretch it, you can't strengthen it. Why? Well, let's talk about its anatomy, its function, and then we'll show you what we do manually. We'll look at Ashley's body, we'll be looking at her hip and thigh. So when we think about what it is, it's a big, thick band of tissue that runs from the iliac crest down to the knee, so just below the knee. Where it becomes an issue is that it is this big, thick band of tissue called myofascial or fascial structure. It's thick, it's dense, you can't do much with it other than what you can do with the surrounding tissues. So what are the surrounding tissues? You have the tensor fasciae lata in front, you have the glute medius and minimus on top, the glute max in the back, and the vastus lateralis, which is the muscle on the outside of the front of the thigh. And those guys are all functioning during running, walking. And so one of the major things that we're thinking about the IT band these days is it has to form a spring while giving stability. So it gives you both assistance and stability. Why that's important is it becomes a problem when those things are not functioning properly. So what can not function properly? The IT band is a thick band. It can become adhered to the surrounding musculature. So we're going to talk about how we stretch those. You can be weak in some of the stabilizing muscles. So we'll talk about that from a strengthening standpoint. And then you can get overuse issues down by the knee where that tendon is kind of snapping over the fat pad underneath it, moving medial to lateral. It tends to put stress down here. So a lot of the distal knee pain is from that. And from a manual therapy standpoint, this is how we would approach the IT band. First thing that we'll do is from the elbow buddy idea is when we use our elbow, we'll get in and find the edge of that band of tissue. It's pretty easy to find because you can usually wake somebody up in a hurry. But as you get in there, you can feel this thick band of tissue and then the soft muscle that's on the other side. You'll usually get a nice response from your client as you kind of get in there, or your buddy partner, because it's going to be somewhat uncomfortable. What you're looking for is any kind of restriction or, stop, because you can get intense in a hurry. If you feel like the elbow's too much, you can get in with your fingers. You can get in like with your thumb, the other hand laying on top of it, because you can find and move around the tissue. Tensor fasciae lata sits in the front. You're going to find that band of tissue. As they lift their leg up a little bit and turn out, you'll feel that muscle tighten up in your hand. You need that for a cue to say, yeah, that's the muscle I want, and you can work on stretching that. What you're trying to do is get in and underneath the muscle a little bit. If you can get them to actively lift the leg a little bit while you're doing it, that helps both of you, one, know that you're on a muscle, and two, to help free that muscle up in its function. When you're working into the glutes, getting in to the back, you're looking for where the hip joint is. If you find the ischial tuberosity, that's the bone that we sit on. You want to move slightly lateral and slightly superior up towards the hip. And you're going to work from there, and you're going to try to start working down and out. So you're going to try to stretch along the outside, because that IT band attaches up to this crest, this little bony ridge. So you want to get there and work through the glute medius, which is underneath my elbow right now. So you're going to work, and then if Ashley just gently moves her leg out to the side, that muscle is going to contract under my elbow. It's going to push me off the muscle. You want to let it push you off. And then as she relaxes, you follow that relaxing muscle, and then you get underneath it. And then as you do that, as you kind of get underneath it, let Ashley kind of contract it again. She'll push me out and then let go. Same thing with glute max. I can get back here. Now glute max is primarily going to lift the leg up. So as she lifts the leg up, I can feel the muscle tighten up. And then as she relaxes, then I can lean in and stretch. The way I want you to think about it, it should be a conversation between you and the person you're working on. If you're just beating on the tissue and trying to make it as uncomfortable as possible, is not going to be very effective, because you need her to relax the muscle in order for you to get into it and stretch it. The other component of where we were talking about, because you're going to work this IT band all the way through its length, you're going to come down to this outer area, this tubercle where it attaches to, and you're going to look for any sign of tenderness there. Often the fat pad is irritated in that area, so you're going to want to see if you can help just gently massage, loosen up that area. This is not an area to dig in with your elbow. Here you want to work on just trying to get underneath that band and kind of lift up on it, and you're trying to calm down, loosen up, because that fat pad has gotten a little irritated and swollen, the nerve's there, so you're just trying to calm it down. So as you get around, loosening up, and often by loosening up all of this, that'll take the stress off of that and allow it to function better.